to be talking to you about abortion. What is abortion, you may ask? It's a deliberate end to a pregnancy to end a child's life so there will be no birth, either by medication or a surgical procedure. Now, my choice on this is I am pro-life. I believe that no child should ever die. They should all have a chance to live. The statistics here show that obviously not everybody agrees and think the way I do. There are 42 million each year, 115,000 every day. And 52% of women having abortions are younger than the age of 25. Now, ages 20 to 24 make up 32%, teenagers make up 20%, and teenagers younger than 15 make up 1.2%. And 93% of women having abortions have them because the child is either unwanted or inconvenient in the lifestyle. There are many different types of abortion. Non-surgical is when they use the two drugs called mifepristone and prostaglandin made by the Upjohn Pharmaceutical Company, which causes women to have violent contractions, causing, once she has the contractions and the baby is coming out, it causes the baby to die because they're so violent, or it causes the child to be decapitated during labor. Also, this is also known as the abortion pill. And there's also several types of surgical abortion, known as suction aspiration, dilation, and Cuttridge. There is dilation evacuation, partial birth, and I'll show you here. Dilation evacuation. They have a pair of hook-like scissors that go into the womb and cut the child into pieces to pull it out. And once they get to the last of it, they have to crush the spine and skull to get the body out. And here we have suction and Cuttridge. It's almost the same as the dilation and evacuation, except they scrape the uterus, usually causing infertility. And if you look here, you can see how the baby looks afterwards most of the time. And here, this is the partial birth abortion. They turn the baby into a breech position, pull it all the way out until nothing but its head is left inside the womb. And here, they put a pair of scissors at the base of the neck, make an open wound, and after that, a vacuum sucks the brain out and the skull collapses, thus killing the child. Very sad way to die, especially since only 3 weeks after conception, all these children would have heartbeats. Every single one of them. If you look here, you can see about the size that most of these children would have been. There's also 2 other types: the hysterectomy, which is where the child is left inside the womb and its oxygen cord, the umbilical cord, is cut, therefore cutting off its oxygen supply and killing it. And one other is called a saline injection, where saline injection is put into the sac, and it's very poisonous to the child, and the child usually ends up swallowing this salt solution. And it's also very corrosive, usually burning the outer layer of skin. In almost any case of these abortions, if a child is born alive, they will leave it to die of neglect or exposure. And if it doesn't die, there's been a few cases where they have been adopted. Now, there are many effects of abortion. Non-surgical, there is hemorrhages, incomplete abortions, pelvic infections, ongoing uterine pregnancy, which then results in having to have a surgical abortion. There's also unrecognized ectopic pregnancies. Surgical abortions have many of the same hemorrhages, incomplete abortions, uterine or pelvic infection, ongoing uterine pregnancy requiring a second procedure, misdiagnosed or unrecognized uterine pregnancy or ectopic pregnancy, a blood clot, uterine perforation, cervical lacerations. And in both of these situations, any type of abortions, there's many mental and psychological effects. And all these statistics were taken 8 weeks after abortions. 44% of women complain nervous disorders, 36% experience sleep disturbances, 31% regret their decision or had extreme guilt. 11% had to be prescribed psychotropic drugs. And physical effects. There's many physical effects to this. There's nausea, vomiting, abdominal pain, cramping, diarrhea, spotting, bleeding. There's also very many serious effects to having an abortion. There's heavy or persistent bleeding. There's infection or sepsis, which is very life-threatening. Damage to the cervix, scarring of the uterine lining, perforation of the uterus, damage to other organs, and sterility, which is you're not going to be able to have any more children, and death. Now, would you want those consequences for getting rid of a child? Now, I'd like to tell you a story. This is a 21-week-old child still in the womb named Samuel. Samuel's mother, Julia, was told that she should have an abortion because her son had spina bifida. And he would probably not survive, they said. He would be paralyzed or be born dead. But at 21 weeks old, she decided to give her son a chance at life and let him have surgery. And here is a picture of, right after the surgery, her son is holding on to the doctor's finger, what I call a miracle, a hand of hope. And if you ever had the decision, I would hope you would give a child the chance to live, because that's what I would do. Thank you.